Well, my girlfriend was getting it done, and we both go see Dr. Bowden. And so I had talked to Dr. Bowden about that because my friend was getting it done, and it seemed to be helping her. And we both suffer from Hashimoto's or hypothyroid, and so lack of energy, tired, and so then that's kind of how I discussed it with her, and then with Dr. Bowden. I've been doing it it's been about 2 years probably. Yeah. I would say it's been, it's so night and day. Not like in a radical, abrupt change or anything, but it's definitely been where before tired, fatigued, getting older, things changing, joints aching, that kind of thing. And like for me, it was like sex drive, I'm very just tired all the time, not interested in anything. And then so gradually after I started getting them and I talked to Dr. Bowden, we did my blood work, checked all my thyroid, and then we were able to get me on a dose of the pellets, and it's something that's just been a gradual change, and I feel back to normal, It's definitely, it's more of a feeling of alertness and being able to kind of contain everything that I need to contain and retain the information that I need to retain and get things done, as opposed to before being so just tired and, it's not like a jittery kind of energetic feeling. It's more just feeling, normal, like you could tack out a checklist and get things done and retain what you need to do for the day, as opposed to just constantly feeling like you want to take a nap. For me, I definitely, I do Pilates and I do a lot of low impact stuff because of the hypothyroid. So I have to kind of keep my heart rate in mind and keep everything kind of steady. And so it's been where I feel like I notice a big difference in tone, muscle tone, just Pilates kind of works that way anyway, but then this seems to definitely emphasize that. That's definitely a big change, because I was one of those where I was always tired, you feel very fatigued, and you can't wait to take a nap or go to bed. But as soon as you lay down, you just can't fall asleep. And then when you do, you're waking up constantly. So it's never a restful sleep. And now I feel more like, I don't know if I'm getting a deeper sleep or, whatever. I don't notice that I'm even getting tired. I just fall asleep and I have a restful sleep. And when I wake up in the morning, I'm feeling like I actually got some rest. I think initially I was a little bit nervous just because I have never had anything inserted that's gonna stay. Yeah. So it was more of kind of like I'm laying there waiting to feel something. Sure. And really it was just like a little tiny pinch and then done. Sure. Yeah, so I never felt, and Dr. Bowden was really good at explaining to me and showing me everything that she was doing and was gonna do. And once she did it, it wasn't anything. Oh, I would say it's a 1 or
1.
Yeah, 0.5. Yeah, it's unnoticeable. It's not like, even if you go in to get Botox or anything like that, you sometimes, will maybe get some swelling, and even if you get them for migraines, you'll get some swelling. Whereas this, you don't even notice, and it's 5 minutes out of your day. It doesn't take any time, and you can just go about your business. Well, previously I had been on oral hormone therapy for years, and prior, it's just like any kind of oral medication that you take. You're gonna take it, and then you're gonna feel it, and then you're gonna feel it wear off. And it's kind of a roller coaster daily thing when you take the medication, and then how you have your troughs throughout the day, and that kind of thing. Whereas this, it was just I didn't notice anything, like I would say, right away, or I didn't notice when I noticed. It was just one of those things where it's like, oh, okay, I feel really good. I mean, it's simple. It's just blood work, and every few months, or if, because I do have thyroid issues, sometimes there's changes that happen even in the middle or during, maybe it wears off a little bit sooner or something changes, where I can go and get monitored and say, oh yeah, okay, we need to make a little adjustment because something's changed with my thyroid. I've gone to Pilates right after.
Okay.
Yeah, I mean, literally, it's a little poke with like an 11 blade scalpel, like a tiny poke, and then a little steri strip, which is not much more than a Band-Aid, and a tiny Tegaderm so that nothing gets like wet inside. Yep. Keep that on for a couple days. But as far as any kind of feeling afterwards, none. I mean,
Great.
Yeah, you don't even notice it's there. I mean, obviously I hang out with my group of friends, and we're all getting older, and so we talk about things, and so yeah, it's definitely something that, you might want to consider this. Well, he's definitely noticed a difference, like with me, where, like I was saying before, where you're just not like interested in any kind of, sex or anything like that, or where sex has even become painful as you get older.
Sure.
And that's changed. I mean, completely changed. And so because of that, he's now like, oh, okay, maybe, yeah. So we can at least be on the same, plane. Yeah, in the sense that, like I said, I'm just more present. It's definitely made a difference in that, where you don't have that foggy feeling that you tend to get, especially if you do have any kind of thyroid issues. She's amazing. I mean, as a doctor and as a person, she's just she's very hands-on. She's different in the aspect of, she is definitely somebody that she hasn't forgotten the investigative side of medicine.
Sure.
So she's interested in making sure and looking for the cause and effect. And so to me, that makes a big difference. To the point where she'll call at home, just to check and make sure, like, how did that go? How's this dosage working? That kind of thing. So that's a big plus. I would say it's definitely something worth scheduling an appointment and going and talking to Dr. Bowden, or to somebody that is knowledgeable in, like I said, I prefer the pellets over the oral. You don't have the highs and the lows, and it's easy, and you just don't really notice. And that's the biggest thing for me. So I would say definitely it's worth getting your blood work done and monitoring things. And it's nice to keep on top of it.